It's a new year. You want to have a family, but you're having a hard time. I'm here with Dr. Aimee. She's a fertility expert. Dr. Aimee, when it comes to some of the fertility drugs, I mean, they can create miracles and make parenthood possible, but isn't there a downside?
There is a downside, and patients should be aware of that downside. My goal is to educate my patients about the risks associated with these medications, but without scaring them not into doing treatment.
Okay, so what are some of the downsides?
So some of the downsides are ovarian hyperstimulation syndrome, and so that can be very severe. I tell my patients there are only a couple emergencies that I have to deal with, and that's one of them. And that's when your ovaries get really big, you feel really bloated, have a lot of pain. But if you're being followed carefully by your doctor, most of the complications can be dealt with in the office. They won't require a call to the 911 or anything like that.
Now, what about the octomom syndrome?
Yeah.
Many babies.
Right. So fertility treatment, it's not news to any of us that twins is fairly common. But it's not just with IVF treatment. So it's with other treatments as well. So we don't have any control over how many embryos actually implant into the uterus unless you do IVF. So with insemination treatment, you could have triplets, quadruplets, or more. But careful monitoring, blood tests throughout your cycle, communicating with your doctor, knowing what's going on as you're going through treatment, all of those things are ways to reduce your risks.
Okay, plus if you're 40 years or older, the likelihood is probably not that great.
Exactly,
that you're going to have
it's low.
Yeah. Thank you. Dr. Aimee is offering a complimentary phone consultation. If you'd like to know more, you can give her a call at 925-277-0600, or you can find her online at draimee.org. Again, that number, 925-277-0600. Thank you so much.
This segment is sponsored by Dr. Aimee.